This station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, all my Florida friends and around the country. Tonight we have a very, very special guest. Something very unusual, something brand new. It's been around, but this man is practicing it. We have Dr. Jonathan Hirsch. He specializes in hip, shoulder, and does arthroscopic surgery, arthroscopic procedure. Now I'm going to let him talk. Doc, how long have you been in Florida?
Thanks for having me. So I've been in Florida I've been practicing in Boca over 10 years, been in Florida almost 20 years.
And you're with the, if I'm correct, Tenant Physicians Group?
Yes, Tenant Florida Physicians Services.
Florida Physicians
Yeah,
Group.
that's our
And let me give them their phone number. They're located right now, I believe, they're located at 9960 Central Park Boulevard, North Suite 400, Boca Raton, Florida. Their phone number, their office phone number is 561-288-4741. That's 561-288-4741. He's going to tell you what he does and how he does it. It's really, really unusual. If you folks are suffering from any kind of shoulder pain, or you think you have shoulder arthritis, let Dr. Hirsch explain to you exactly what he's doing in a new procedure. Doc, I'm going to leave it up to you. Tell the people what you basically are doing.
Thanks. So, for shoulder arthritis for years, we've been doing shoulder replacements as a cure, right? So if someone has end-stage disease, pain from the arthritis, which is loss of cartilage, we've been replacing shoulders for over 30, 40 years. What we've found in many patients, especially chronic cases, is the bone starts to deteriorate, or you get a deformity, which makes putting an implant in or a prosthesis in very difficult. So over the last couple of years, the technology has advanced that we use three-dimensional imaging. We use CAT scans, which give us a 3D model of the bone. And when I do my shoulder replacements now, we take that model and put it into a computer system. So we use GPS technology. So while we're actually pre-planning the surgery, we can play around on a computer what implant fits the person's anatomy, which is not always so normal. And we're trying to recreate normal as much as we can. And then in the surgery, we live on a computer screen can watch what we're doing. We can put the implant in the patient, put screws in the direction we want to put them in. So we basically take the plan from the computer and reproduce it in the operating room. There's no guessing involved. You can basically plan a very complicated surgery before you get in the operating room and do it quite successfully and have a better outcome.
So that's like building a house, what you do when you're putting a plan together. So when you go in there, you know exactly where the pieces fit.
Yeah, it's important. In a straightforward case where the anatomy is relatively undisturbed, but the patient has arthritis, those are straightforward cases. But most of the cases that I see, a lot of them, people have not just arthritis, but they also have torn tendons, which makes the anatomy really distorted. And when you have distorted anatomy, that's where this technology really comes into play. And again, to have that feedback right in the operating room, looking at a computer screen, watching where the drill is going, watching where the implant is going in a three-dimensional model, it's just like building a house. We're following the plans accurately that we made before surgery.
So let me ask you, Doc, is the healing process much faster? Is it quicker? Is it more? Is the outcomes a lot better with the system?
So the healing is quite similar. A routine shoulder replacement operation from the outside looks very similar. Mm-hmm. When you add this technology, however, what we are doing is having longer lasting prostheses. We're putting in an implant that fits the patient. Each case is pretty much individualized now. So the size matches. If there's a deformity, we can correct the deformity, meaning that a reshaped bone. So the outcome will be much better. The results early on will be better, and it will last much longer.
What are some of the symptoms that the patient would have? Like he might be complaining just of shoulder pain or something. What are the symptoms that he might have that might say, I have to go see Dr. Hirsch? Why would he come to you to see you? What are those symptoms he's gonna be looking at?
Sure, most people who come to me with a shoulder issue, it's pain is their number one complaint, weakness maybe their second complaint, and it's usually a loss of function. A lot of people can deal with mild discomfort, mild pain, as long as it doesn't limit their ability to sleep. That's a huge one, or to play tennis, or to play golf, or to work. So once it starts to interfere with their quality of life, that's when they usually call me.
And that's the same thing like if a guy is suffering from knee pain. He finally can't suffer so much he can't play golf, and he was going to go see for the knee replacement.
Correct.
Same thing with the shoulder.
Correct, yeah.
The other question is, what's the age group you would take or you would treat?
For shoulder replacements?
Yes, for shoulder replacement.
So-
Does it usually happen to elderly people or younger people?
In general, most patients we're putting an implant in is 50 and older. All right, so there are the occasional outliers in their 40s, 30s, really rarely in their 20s. We're putting in a metal, sort of combination metal and plastic prosthesis that may or may not last your lifetime if we put it in when you're 30s. So we certainly try as many alternatives as we can until someone gets at least into their 50s and 60s. We'd like to only put one in your lifetime. But some people are suffering in their late 40s, early 50s of bad arthritis for a multitude of reasons that we will offer them this as a last resort when nothing else is working.
You know, everybody uses the word arthritis or osteoarthritis. What is the difference between, people say, well, I got osteoarthritis. What's the difference between arthritis and osteoarthritis?
So arthritis is a more generic term for basically a joint breaking down. The cartilage, the end of the bone, the shiny white stuff on the end of your bone breaks down. So osteoarthritis is more of the garden variety genetic arthritis, where the breakdown of the cartilage is either genetic or maybe due to old injury or an old fracture. And then you have the inflammatory arthritis, rheumatoid being the most common, where the body has a disease that's attacking its own joint and breaking down cartilage. Gout comes into that category as well. So those are kind of the two basic categories. The end result of arthritis is in and of itself the same thing. How you get there is the difference.
Now, you specialize in what they call sports medicine.
Correct.
There's a lot of people say I'm a sports medicine physician, I do sports medicine. What makes you different doing sports medicine than, say, the average other guy doing sports medicine?
There are a lot of us out there. And sports medicine has multiple meanings. So for us, from a surgeon's point of view, when we do a sports medicine fellowship, which I did, we spend a lot of time doing surgery on athletes or athlete injuries on, let's say, weekend warriors or even patients who didn't have an injury at a sport, because it's really arthroscopic surgery. So sports medicine and arthroscopic surgery are kind of linked because we treat most of our sports injuries surgically with the camera, with the arthroscope. But we also learn how to treat the non-surgical management of sports injuries and try to get people back to being active. So I think sports medicine really is just a field in getting people back to activities of life, whether it's sports, work, what have you. But it sort of comes under the umbrella of sports medicine.
I mean, that could be a local individual, or it could be a professional athlete. It could be anybody. Guy that's out there just playing baseball with his kid or softball with
Absolutely,
his kid.
yeah. My practice is anywhere from that guy playing softball with his daughter versus a professional athlete.
What, arthroscopic versus real surgery. What is the difference between arthroscopic? When you say arthroscopic surgery, instead of doing cutting the person, so you basically don't cut them open, you're just doing arthroscopic.
Right, so arthroscopic surgery is still surgery. It's still real surgery. You're under anesthesia. It's in an operating room. It's just how you're doing the procedure is less invasive or minimally invasive. So we're making holes, basically the size of, the instruments are, say, the size or diameter of a ballpoint pen. So we're entering the joint with multiple holes, just like my general surgery colleagues do in the abdomen. They take out an appendix through a camera. So we're using a scope to do sometimes very major reconstructions without damaging the tissue on the way in.
So would that be a preempt before you did surgery? Would you be looking at doing something like that in the shoulder? Does everybody have to have shoulder surgery? Or at what point does they really got to go to do shoulder surgery?
So again, arthroscopic procedures are surgery. So in general, we are trying conservative care in most patients, but there are definitely things that come my way where when I see it, it needs surgery. There is no other option, or the best option is surgery. But the majority of injuries that come to the office, that is not the first option. You know, surgery, whether it's open surgery, arthroscopic surgery, is the second option. The first option may be therapy or medications or modification of activities.
So that being the case, at what point would you determine that a shoulder replacement is necessary?
So shoulder replacements, it's very unique to the individual. You can take the same horrible x-ray, let's say advanced horrible arthritis, and each patient may have a different experience with that arthritis. Same thing in the knee and the hip. Some people have an enormous amount of pain. They've already come to me and tried injections and medications, and from my first consultation, surgery is the recommendation. Others can have really severe arthritis and only have mild symptoms. They just come in because for a couple of days it's kind of bothering them late at night. And just because the x-ray shows the joint is gone, basically, they don't need a replacement. They just need education, advice, maybe some medication. So that's why every patient's unique with all these diagnoses.
So in essence, there's no perfect candidate for surgery. It's all depending on the individual and what their
Sure.
experience are.
First, they have to meet the criteria of actually having the arthritis in the first place, right? You want to make sure that their x-ray shows you that they have joint disease, breakdown of the joint. That's certainly a criteria, but then there's so many other criteria as well.
Doc, what insurances do you accept at your center?
Basically all of them. We're on all the managed care plans, Medicare, workers' compensation, pretty much everything really that South Florida offers.
So, folks out there, if you're suffering from any kind of pain in your shoulder and you want to try a new procedure, this is the gentleman, Dr. Hirsch, is the guy to go see. He's been around town about 10 years, Doc, around Boca?
I've been in Boca 10, yeah, in South Florida almost 20 years
20
now.
years. And you studied, where'd you study, Doc?
I did college at Duke University.
Can't get better than that, Duke.
Did my med school at New York University, and then did my training in New York, and then I did my sports fellowship at the Cleveland Clinic in Ohio, and then practiced in Philadelphia for a while before I moved to Florida.
See,
So you can't beat that for credentials, can you, folks? Look at that, Duke University. He followed that Duke basketball team all the way to the finals, I guess, a couple of times,
Multiple
right?
times, yes.
Right, a couple of times he watched to the finals, and he went on, and he did his residency, I guess, at Cleveland in Ohio,
Yeah, my fellowship was there.
fellowship in Ohio. We're going to take, is it time to take a break? Is it a few minutes? Let's take a 30-second break or 60-second break, and we'll be right back with Dr. Hirsch.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, folks. We have a special guest, as I said earlier, Dr. Jonathan Hirsch. Dr. Hirsch is located at, let me give you that address again, 9960 Central Park Boulevard, North, Suite 400, Boca Raton, Florida, and his office phone is 561-288-4741. We're sharing the stage tonight with Delroy Clark. He's just a newcomer to All County Healthcare. Delroy's going to be with us for a while, and he's going to be asking Dr. Hirsch a couple of questions. Dr. Hirsch, beside shoulder surgery, what other types of medicine do you practice?
So the other surgeries that I do, the other parts of my practice, I do a lot of knee arthroscopy, ACL reconstructions, meniscus surgery, and another unique surgery. Not many of us in South Florida are doing hip arthroscopy, sort of a really expanding field in the last 5 to 10 years where we can now enter the hip joint much more successfully with the arthroscope and do labrum repairs, labrum reconstructions, and a lot of major hip surgery now through the scope that we couldn't do before. So that's an exciting sort of newer surgery that I'm performing here in South Florida that not too many people do.
What is the downtime with arthroscopic surgery that you're doing for a patient? What's his downtime usually once you do that?
So it really depends on the diagnosis. You know, in the shoulder, if you do a rotator cuff repair, which is a tendon repair, you know, you can have a recovery that could last 3 to 6 months. In ACL reconstruction, the downtime may only be a couple of weeks from work, but it may be a year back to sport. So a lot of what we do, the downtime goes in phases, you know, downtime from school or work, and then the downtime from returning to full activities. So a lot of people are back walking normally or, you know, going to work within a week to 10 days of these major procedures, but because of the healing time, we don't let them do certain excessive things like sports for months.
So if he's going to play golf, how long is it going to take him to play? Let's say he has 2 torn meniscus. I'm talking about me.
Yeah.
I have 2 torn meniscus. Now, what would the downtime be if he did arthroscopic surgery versus a complete knee replacement?
So,
Could you determine whether he needed a complete knee replacement or arthroscopic?
right, so the best patient for the meniscus is if they don't have arthritis, right? So if you have no arthritis in the knee and just a torn meniscus, certainly if you're over the age of 50, let's say, we're usually not repairing that meniscus. So your downtime from a meniscectomy, which is just a trimming of the meniscus or a cleanup of the meniscus, you're only out of sports or golf for 2 or 3 weeks if all goes right. So that's a pretty quick recovery as opposed to a major repair or reconstruction, which could be months out of golf. So it's quite a difference depending on the diagnosis.
How would you know if somebody said, oh, you have a torn meniscus? How would you know prior to going to surgery, if someone came to you with a torn meniscus, would he be better off? Would you make that diagnosis of saying, listen, you need a complete knee replacement or this arthroscopic is not going to work?
Right, so X-rays can answer most of that question, and then MRI completes the question. So
Okay.
the X-ray will show us how much arthritis you have. The MRI will show you if you do or do not have a meniscus tear. So that's why every patient gets both an X-ray and an MRI. You need both.
So if he had the torn meniscus, right, and he had arthritis, could you still do arthroscopic?
If it's mild arthritis, yep, and that's a very common scenario where someone has a little bit of arthritis and a torn meniscus, and that's an everyday conversation I have in my office because we can't cure the arthritis with the arthroscope. But if it's not that bad, sometimes we'll do the meniscus and see how it goes.
And how long would that procedure last to help that person?
If the arthritis is minimal to none, it's going to help them for life. You know, we're going to get rid of that torn meniscus, and most patients will do great. Or, you know, there's outliers who don't, but the majority will do excellent.
So if you're suffering from, somebody said you had a torn meniscus and you're thinking of doing a knee replacement, my suggestion, you go see Dr. Jonathan Hirsch, let him make a decision whether he could do arthroscopically. Listen, the downtime is great. You'd be back in that golf course much earlier than you would if you had complete knee surgery, and the outcome might be just as good. Am I correct?
Right.
So if you're suffering from what you think is torn meniscus, somebody told you that, and somebody's telling you to go get a knee surgery, a knee replacement, my suggestion is at least get an opinion from Dr. Hirsch. I'll be up to see you.
Thank you. I think making the right diagnosis is clear, and that sometimes people are a little cloudy on that.
Yeah, so that's a very important thing because you don't want to be out laying in bed, doing 6 to 8 months before you can be back in that golf course, or 3 to 6 months being on that golf course again.
Right.
So, Doc, other than that, as I said, you could treat anyone. What ages, from young ones to old ones?
Yeah, I treat basically adolescents to 99, 100. Yeah, so really from adolescents on is my practice.
Delroy, do you have a question for the doctor?
Yeah, so myself included, when you have issues, you go to your regular physician, then they refer you to a specialist. If me, the layman, want to come see you, what would I be looking for to determine that I should go see Dr. Hirsch?
Well, I think that, most people have tried something on their own, whether it's just over-the-counter pain medication, but in my practice, I don't require you to see your primary care physician first, unless the insurance requires that, which obviously some do. But if you have joint pain that you cannot deal with, that's it. I mean, that's really the criteria for my practice. And then we'll figure it out, whether you need me at all. Some patients come to me and I don't need to see them again, and what they have is either a different specialty or it can be dealt with in other ways, or we'll work with a therapist and work together.
So to get an appointment, Doc, you'd have to call your office?
Call my office, or you can go online on our website, and you can actually make an appointment online as
All right,
well.
that office number again is 561-212-4638. That's 561-212-4638. And I'm sure he'll get you in. I don't think there's a 3-month waiting period before he
No.
sees you. He'll get you in as soon as possible. Am I correct, Doc?
Yeah, that's no.
Because I'm not waiting 3 months.
No, for someone who treats injuries, it's really hard to have a 3-month waiting list.
All right. So the other thing we're talking about, he treats, as I said, he had multiple sports medicine injuries that he does. And we're going to go over that GPS thing again. So a lot of people might not understand what you really said about the shoulders. So if you're suffering from shoulder pain and you're going to go to a regular orthopedic guy that does shoulders, I suggest you at least come and look at let Dr. Hirsch give you a consult and explain to him the difference between doing regular shoulder surgery and shoulder surgery with this GPS system. That I understand is very few people can do that. Correct, Doc?
Yeah, it's only people trained on this system by a company called Exactech. It's actually out of Gainesville, Florida. That has really changed the ballgame for us, making it a much more accurate shoulder replacement is much more accurate and custom. Every patient's shoulder replacement will be custom fit to their shoulder, which is extremely important.
That's like getting a suit. You know, you get a suit off the rack or you go get a custom
Correct.
fit suit.
I'm a tailor,
Right?
exactly.
He's like a tailor. He goes in there and he custom fits that joint for you. You know, and that's very important because I can tell you right now, a friend of mine had knee surgery done, and she went to another physician, and another orthopedic, and that orthopedic said, listen, it's the wrong size knee for you. That's why you're in pain. So what this basically does, this tries to eliminate the factor of getting the wrong size shoulder replacement. Am I correct, Doc?
Yeah, we basically do the surgery virtual before we do it. We do it on the computer and make sure we've got what we want. We fit the prosthesis to the patient, and then accurately reproduce it in the operating room.
Well, it's just like I said, building a house. What he does, he takes the plan and he puts the pieces in the right place.
Correct.
So, Doc, is there anything else you'd like to add to this, what we're talking about tonight?
No, I think that you've touched most of the bases of what we do in my office. I think that we're very user-friendly. We're not a place that's going to hustle you in and out. You know, I pride myself on really listening to patients. 90% of what I do is and make a diagnosis is just listening to the patient and examining them. We're so sort of stuck in the MRI technology world where a lot of docs are basically going off MRI reports and not spending enough time with the patient, because sometimes the MRI findings, especially the over age of 50, 60, has nothing to do why the patient's in my office, because MRIs are so accurate, they're going to find things wrong with you that actually aren't the cause of your symptoms.
Can you do that right in your office, the MRI?
No, we don't have an MRI there, but we work with some local facilities.
Okay.
But it's just a tool. But the real tool is us examining the patient and talking to patients.
The other thing, Doc, during this COVID time, a lot of people are scared. A lot of people are scared of going in office. Safe to come into your office, I'm sure.
Everyone's wearing a mask. We practice social distancing. The staff cleans every room after the patient leaves. And 100% of the staff, all patients are required to wear a mask. And we've had really great success staying open during the pandemic.
Doc, thanks a million. As I said, we were waiting here. Time that went by very slowly. We're on the air. Time flies by. Again, Doc, thank you for coming in. And you folks out there, make sure you go see Dr. Jonathan Hirsch if you have any kind of shoulder pain whatsoever.
Thanks for
Thanks,
having
Doc.
me. Appreciate it, guys.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed